So in both of our spines, and I noticed we're born 2 days apart, Carla.
Oh, yes.
Right, so I'm not sure if that month everybody was getting scoliosis that month. Anyway. Go, chin up. There you go.
Oh, I felt that in my ankle.
Yeah.
Do this.
We're going to try to tilt to the right. This is what we have to work on. Oh. She's just getting thumbnail, I think. Oh.
It's technically my whole left side of my body.
Okay.
My whole right side feels fine, loose, limber, but the left side throbs. If I'm laying down on the bed just sleeping, it pulsates.
Okay.
The arm, here, the hip, legs.
Kind of
like,
nervy, achy?
No, just like it's beating.
Really?
Like it's just, like the muscles are just beating for some reason. I don't know why.
Okay. All right, look at you here. So just relax as best you can. So we can see this right shoulder is a little bit high. You're almost, avoiding, so potentially something's on your right side that you're wanting to get away from.
Yeah.
And there's a shoulder tilt. Let me look at you.
I do have scoliosis, a thoracic and lumbar scoliosis, so it's like an S curve.
I gotcha.
Yeah.
I have a scoliosis in my spine, and the scoliosis can be fed because it feels good to lean away from the joints that are inflamed, and we sort of make it larger than it needs to be. And so I think when I think of scoliosis, I think we can bring it back down to baseline.
Yeah.
And we don't know really where that is until we start working on you.
Okay.
But because there's an asymmetry, who told you about that?
No, I've seen it on X-ray, and yeah, I just seen it on X-ray.
I
That's
gotcha.
it. And I can kind of see it when my shirt's off. Like I can see the curves. So.
Right. Yeah. No, one of my ribs sticks out more on the
Yeah,
outside.
and I have a hump here.
Right. Well, that's the counter curve. So it goes to they always go to the right in the chest, and then they go left in the lumbar. And that's sometimes because the heart's on the left, and so it almost always goes to the
Away
right,
from it? Yeah.
away from the heart. And because of that asymmetry, and you're saying your whole left side pulsating. When you say lower back, is it sort of middle?
Yeah, middle. Like, well, in the middle here, which I think is where the hump is.
Sure.
So I can feel the little point, I guess where the apex of that curve is, where the
Sure.
point of it is.
Sure.
Like I can feel, not pain, but like I just feel it there.
Right. Yeah. You see, it's not so much that the musculature, like you'll see the muscles are actually,
Imbalanced.
it looks like it's bigger on this side. But
Yeah.
actually, part of scoliosis is there's a rotation.
Right.
So the transverse process is pushing the muscle up on the left side here, and you'll see it also on the right upper it's from a rotation of the
And I have
vertebrae.
the wing scapular, I'm pretty sure you see it there.
Right. So
Only on that side.
So the spinuses actually try to stay in the middle. You won't really see much variance on the spinuses, but because the vertebrae are rotated, the right upper and then the left lower, it'll be bulged out because of that rotational component. So I don't demonize scoliosis because scoliosis, if it was such a bad thing, then why do I have plenty of people with straight spines with terrible disc injuries, right? I don't think that there's really any difference in terms of back surgery. I have plenty of people with straight spines that have plenty of back surgery, and people with scoliotic spines that have less back surgery. So I've never been able to just say, okay, scoliosis is somehow a worse subset. I actually would almost argue that a scoliosis has a third dimension of shock absorption. So we're supposed to have these front to back curves in our spine. There's supposed to be a curve in your neck, curve in your lower back. The whole purpose of the curve is to have the weight of your spine spread out over all the segments.
Okay.
If we have something that's straight, you create a ladder effect where all the weight gets transferred to the bottom. So in both of our spines, and I noticed we're born 2 days apart, Carla.
Oh,
Yeah.
So I'm not sure if that month everybody was getting scoliosis that month. The secret with our backs is to understand that you have to keep it mobile. What we find is that on the high side, like this side will be more inflamed, and then this side, and so what will happen is because these joints get inflamed over here, you'll want to lean away from them. And it isn't comfortable, to tilt into the joints that are on what we call the high side of the scoliosis. So there's a high side on the right and there's a high side on that left.
Yeah.
The main point of that, like I said, that third dimension of shock absorption, I would argue we see less disc injury in scoliotic patients. Disc injury being the sort of defining thing that determines the health and longevity of your spine. There are these non-sensitive cartilage pieces in between the vertebrae, and because we have a third dimension of shock absorption, you have a third.
Which is a good thing.
Right. So I know you're not going to hear that.
It's a good thing. I know. I never heard that.
I never
but
heard
it
that.
makes sense though.
But right,
Because the body kind of learned to adapt to it in a way.
So a lot of what happens is we're actually supposed to be taller. If you took our spine and pulled it straight, we'd actually be taller. Right? So it's like one of those people driving down the road and they cut the corner like a roundabout. They don't want to take the long way, so they try to cut the. So what happens is I believe, and actually not believe, I know that the spinal cord is not long enough. So your brain is tethered to your tailbone.
Okay.
And essentially the spine buckles laterally to relieve pressure on the spinal cord.
Okay.
So it actually has to happen. And that's but we can feed it to be larger, but to me what I've said earlier about it being a baseline, there's only so straight you can get it before, or if you try to straighten it farther, we actually see what we call spinal cord tethering.
Okay.
They took people and they pulled the spine, scoliotic spines, they tried to surgically pull them straight.
Yeah.
And the brain starts to actually get pulled into the neck.
Oh, wow.
So we call that spinal cord tethering because the spinal cord is not long enough. Do you understand? The spinal cord that's housed inside the spinal column,
of how it's shaped,
it's not long enough.
Right.
And so the spine, the column buckles to relieve pressure on what's inside the column.
Gotcha.
And so it's not really about, it's about understanding the pains that scoliosis creates, which is asymmetrical joint pain. One side, the joints are like handshakes. On one side, the joints are more open. On the other side, the joints are really closed. So some joints are swollen, some joints are not swollen, and that creates just an asymmetrical feeling. And the main take home I have with scoliosis is keeping everything limber, keeping everything supple, and at the end of the day, to me, we're still stuck with the same issues that a non-scoliotic patient has, which is sitting, we put all the pressure on the lower back, and then we have asymmetrical joint pain. So it's more that the knuckles in your spine. Now, like I said, you said earlier, it's going into your arms or down the leg.
to here,
Okay.
we're not pain, just here's tightness.
Do you feel the muscle? Can you actually see the muscle fasciculating at all?
No, I never looked to see if it's pulsating,
You'll
but
see
as
it.
I'm laying down on the
You'll
bed,
feel it.
I could just feel it just do-do, and it was doing it in my neck too, but I guess through the other chiropractic here, that went away. But now it'll do it here, it'll do it in my butt, like in certain part, my upper part of my butt, it'll do it in my leg, like just on this side, and my toes got numb. For the past 2 days, these two were numb, and then
Yes.
this one was kind of numb.
Yes.
Now, mind you, doctor, I've never had an issue with my scoliosis until
Right.
8 months ago, and I don't know if it's because I'm like a party person,
Gotcha.
and I move around a lot. Like
Yeah.
I like to dance, and then once I had to work from home, I had to be stagnant. Everything COVID, everything shut down,
Yeah.
and that's when it kind of just flared up. Because I said, since I'm home, let me start working out. And I started to work out my upper body. I normally only work out my lower body.
Gotcha.
And once I worked out the upper body, it was like, what are you doing?
Gotcha.
And that's when everything started. This started to get big, like it just started inflaming. It was really hurting.
What I typically see especially if it's like arms or chest workout, is that the core, the muscles in your chest get tighter.
Yeah.
The tighter this area becomes, when we bend or when you're dancing, it's more likely that your lower back does extra.
Okay.
So the lower back is what controls your feet.
Yeah.
So the cartilage that supports open the hole that the nerve goes through, if you're having numbness, is it numb now? Is it numb right now? Or you said on the drive here it got a little numb?
Yeah, no, in the drive here, it got like pain in the leg. I was like, I really have leg pain by driving for 3 hours? Like,
Gotcha.
that's just crazy.
Right, so we have some level of inflammation at the very least. If we're going to exercise our chest, we have to do things to keep your chest limber.
Yeah.
So, if you want to strengthen it, that's okay, but we want to it's about balance. We can't just be, bench press and,
Mind you, I broke my humerus bone over 10 years ago, but I never physically developed it back.
Gotcha.
And since I never worked out my upper body, it was kind of like I don't care, and I'm right-handed, so it just stayed there. Now I decide, let me go ahead and work out. I'm doing push-ups. This is shaking.
Gotcha.
So it was imbalanced already.
So now you feel right.
So now I don't know if it did something, because it just...
Tell me how that injury happened. How did you break that? What was the...
Protecting this girl from a fight. This guy was fighting her, and I jumped in, and when I went to hit him, I guess he saw that I had long range. He came under me and flipped me. When he flipped me, I went down like this.
I got you, bam.
And then I jumped up, and I went to, I jumped up real quick to hit him, but this was completely apart. It literally snapped like it was.
No.
Yeah, it took like 2 months to heal, and then I started doing my own little physical therapy, but I didn't officially, professionally get it taken care of.
They didn't put any raw, they just
No,
approximated
they just put like something right here.
They just, gotcha. All right, let me have you start on your back.
Yes, sir.
And then exhale for me. Exhale, let it all go. Deep breath in. Exhale. Deep breath in. Here we go. Exhale. Chin down. Deep breath in for me. Exhale. There we go. That side for me. Exhale. Let's go face up for me. Beautiful. Okay, good. Right side of your neck is all out of alignment here. Feels like my neck. It's because we have a favoritism to tilt our head, so this right side's all tilted out. You know, real gentle here. All right, I got you. There we go. Let it go. Chin up. There we go. Good. There we go. There, I got you. Real gentle. There we go. Good.
I think it's amazing how like things refer, because I always thought I had an issue with the left side of my neck.
Right.
You know, that always felt tight.
Yeah. And then you have this.
But you're focusing on the right.
Feel that bump right there?
Yeah.
It's,
No, I've seen it up before.
yeah, it's stuck right there. Clear that.
What is that though?
It's like a muscle that's actually larger here because this side's being pulled on all the time.
Yeah.
So this muscle sort of hypertrophied and developed a little larger.
Like I
it's a
know not to
spasm,
sleep
yeah.
on my stomach,
Mhm.
but I can't even sleep on my back. Like it's
Gotcha.
uncomfortable. It's making
Right.
me go to my stomach.
Right, that's exactly right. So what we try to do is we try to make the spine cleaner, and then you won't need to avoid it. You got power in here. Actually, some lymph nodes. These are lymph nodes right
That's
here.
what I thought.
Yeah, these are from the restriction in here. There's lymphatic blockage, and this eventually causes
knew
sinus or ear.
Yeah, I actually suffered from mold toxicity. I'm clearing it out now,
Mhm.
and it really harbored in the left side of my nostril, and that's because that
Yeah,
wasn't helping it.
All right. Like I was saying earlier, 24 vertebrae and 5 have all sort of surgery, and so what we want to do is I leave certain areas specifically alone, and we try to just focus on the areas around. You can sort of see it right there. There's just a clog.
I did a lymph cleanse, like Ayurvedic, like herbal lymph cleanse. I did it for like 3 months, and it went down a little bit, but it's still there.
Yeah, to me, it's more about the ears and nose and, the other things that need to be able to use these highways. These are highways that your neck, houses that are draining your face.
Right.
And it's more that, and I got a tooth issue. I got a sinus issue or an ear issue.
Your lymph is clogged.
Right. And nobody goes in here and tries to detangle this. It's very similar to tangled hair. It doesn't untangle itself. You have to put work in to untangle. These are clogs and tangles, and
Yeah.
or like plumbing. You have to plunge.
That you were pushing right here.
Upper
Like,
trap. Yeah, we're gonna work on that in a second.
Is it something there?
Yeah. There's some, those are the attachments. Those are the other end of the same muscle at the top here. Attaches down here in your shoulder, and we're gonna clean those out.
Oh.
Right. See, the right's actually more tight. It's interesting. The left, like real quick, there's a mark coming out on the right side of your neck. Right around that knot here that I don't like, on that right upper, right there.
I thought that was a lymph too when I saw it, because I normally don't have that.
Yeah.
I thought it was. I was like, is that a lymph coming out or something? But
I don't believe so. I believe
No?
this. There could be, like that right there could be a little lymph node. Yeah, it could be a little lymph node, but there's also mainly a tight muscle
Yeah.
underneath it that's. But this side's actually creating the mark.
It happens down here
Okay.
when I lift the arm up. While I'm sitting down. So
Right.
I'm like, did I dislocate a rig or something?
Is that hurting right now when you lift your arm?
No, it doesn't hurt, but it makes an indent.
Interesting.
But it doesn't hurt though. Not right now. No, it doesn't.
Do both arms at the same time. Yeah, I see what you're saying. It definitely goes in a little bit.
But even standing up, there's space here and no space here.
Part of it is because of the scoliosis. That because the chest is not straight, you understand? So one side's going to have more of a gap. Your arms, like for me, this arm's going to be closer. There's going to be more of a gap.
Yeah,
because-
that's how mine is.
It's because our chest, essentially our torso's over to the right.
Yeah.
I'm exaggerating, but this is so you can see it. This is how
Yeah,
we
yeah,
kind of
yeah.
want to be.
Technically, yeah.
So we have to do this maneuver.
Yeah.
Try to. So you're going to see more of a gap because it's just a favoritism. I gotcha.
Yeah.
I gotcha. I won't drop it. I promise.
That means that I didn't let it go?
You just tried to drop it. I'm just trying to see, because part of this is guarding, and I'm trying to distinguish what is injury and what's just your muscles are guarding and tight, and what is just from, you know, an actual old injury in here. And
Should we write down?
There you go. There we go. Checking tricep back here.
Oh yeah, my traps are weak. The triceps are weak.
Yeah.
Weak.
I got
The
you.
whole arm is weak, to be honest.
Mhm.
And the funny part is it swole so big. I can press it like water, and like there was fluid in there, and then it shrank down, and it's like completely different than this arm.
Yeah, like right there. There's definitely some old battle wounds that got trapped in there, and it's time to start opening it up and getting
Yeah.
some blood flow in there to.
Yeah.
You know, it's like what happens is when you have a trauma like that, your body kind of half expects that you're going to do it again,
Yeah.
right? So it like puts protection in there. He's going to get flipped and
Yeah.
land on his arm again, and so
Snap it.
we better guard things. And
Wow.
so it's kind of the goal with this is to sort of try to talk to your arm and say, "Look, I'm not going to fall again," or "I'm not going to put that much stress in my arm again." And
I lost grip muscle and everything. Grip strength.
Right,
That's all of that. And I noticed when I do like dead hangs, because I was doing that to try to relieve the pain of my back.
Yes.
I would notice the left arm is not gripping right. So I stopped doing it because I'm like, am I hurting myself more by just stretching this side now, which is already high?
You want to let this arm catch up. You want to try
Yeah.
to I don't want to push the right until this guy.
Yeah.
Yeah.
I started doing like finger exercises,
Sure.
like to try to strengthen it.
Like only exercise that side. Like if you only can do 10 reps at a certain weight on this side, but
Yeah.
you can do more on that side, don't.
Okay.
Stop. Like if you do, I don't know, 20 pound, 10 reps, but you could do 20 reps on the right, but you only do 10 left. I would only do 10 on the right, even though you could do more.
Right. Or half.
Right. I'm just saying you're going to have to, you want the left to, otherwise I call Rafael Nadal, that tennis player whose left arm is just like Arnold and his right arm's a little twig.
Yeah.
You know, it's like, oh, geez.
Doesn't make sense, yeah.
How asymmetrical are you? So, I'm just checking to see, if it's, I don't think there's, it's just now, it's just gotta be use. You gotta start utilizing this side. It's just
Yes, sir.
part of it, your body thinks another injury is happening. Let's go face down for me. This is where I usually, this right side, these are the joints that get swollen up here. And we gotta keep, so I'll show you in a minute how we're gonna stretch. We're gonna actually tilt you to the right, and we're gonna try to confront these swollen joints. So these joints over here get swollen, and then the joints on the left lower get swollen. And we wanna keep these areas as mobile as possible. It's the same battle that people with no scoliosis are fighting, of the chest locking down and losing mechanical mobility in here.
Yeah.
And that's it. Just becomes about, this side. These are just the roots right here. We clean all this out. When we're sitting for a long period of time, the middle back tends to get stiff, and so your drive here, this area gets tight, and then that sends all the stress down to your lower back. And then even when you're driving, I'll show you in a minute how we can put something behind your back right here to keep the arch, that lumbar lordosis, as much of that arch as possible.
Yeah.
And that should, at least for your drive home, you won't have it when you get home. That's too tight right there, I know. There we go. If I'm ever going too deep, let me know. I'm going to keep going deeper and
You
deeper.
go ahead.
All right, here we go.
I'll just have to take it.
All right, here we go. All right. There we go. bruising alongside the spine can sensitize a nerve and make it easier for a nerve to fire.
Yeah.
So cleaning the spine, what I mean by that is that the tissue alongside your spine is no longer tender. There should not be, it is not normal for your spine to be sore or bruised or tender. All of that is a buildup right here. It's all gotta be.
Yeah.
So it can be in this alignment, but it needs to be clean. Just
Yeah.
because this muscle is working harder because of the alignment,
Yeah.
or that it's pushed up and feels bigger, but there is a little extra stress on the joints in here, and so the muscles are going to be tight. We want to keep that muscle as clean as possible so there's not much acidity. The acid, the lactic acid specifically, the nerves travel through the tissue alongside your spinal column, and if there's all this acid alongside the spinal column, then obviously the nerve's going to be agitated, and then it reaches its firing point, and you feel it down your leg. Or
Makes sense.
yeah, so we want to clean, no soreness along the spine is sort of the first goal of my care. Ed, can't you push any harder? Perfect. That's all you got.
That side, right?
Yeah.
That's muscle though, right?
It's rotated. So the vertebrae actually is rotated. And so because there's a rotation of the vertebrae, the muscles are popped up here.
Yeah.
So it's just trying to unrotate it a little bit just to compress the joint. The swollen joint will give you that localized pain in there. And,
Yeah.
it's the cross we bear. We have to just be aware of it.
Yeah.
So the bones, because they can grow faster than the nervous system can grow during a growth spurt, does that make sense?
Yeah.
That the bones are outpacing the nervous system, and so that buckling formed typically in the teenage years during or after the growth spurt, that the spine was compensating to that extra growth, and it buckled the spine, and the nervous system never caught up. It grew to, it's like I'm 6'2", but if you pull my spine straight, I'd be 6'3" or 4", right?
Yeah.
Kind of idea. But I only can be as tall as my nervous system can handle, right? You only can be as tall as the spinal cord, and then when we're exercising, because our spine's getting an asymmetrical output, we're not getting symmetry in terms of our muscle utilization.
I hear you. Is that why we have imbalances?
Right. Well, favoritism's like, this side's going to be stronger.
Yeah.
We can reach farther with this side. The hip is on the same circuit as the lower back, and so the lower back being upset, having inflammation in here, having sensation in your leg, so you're
Yeah.
saying, and then the hip hurting,
Yeah.
are all sort of the same thing. We're going to clean all that out.
It made the muscles tight, like it made my hip flexors tight. And I'm like, okay, so I can't even do what I used to do before, like in regards to flexibility. I feel like I'm like a beginner now. I can't, and it's like I have hip flexors and I'm stretching, but I'm like, is my hip out of place? Why I can't release it? Or is that keeping me tight and pulling my hip?
I'd be working on getting the curves first. We work on,
I
so a
hear
lot of the
you.
muscles go awry because our alignment's not correct.
Yes,
And so
yes.
trying to work trying to stretch your hip flexors or,
Right.
psoas or something like that, I go, the psoas is tight because you don't have a curve in your lower back.
The psoas, yep.
So as you get the curve in your lower back,
Yeah,
the psoas won't be so tight.
I hear you.
So let's just clean your spine. There we go. Right there. Yeah, it's real tight right here. It's my back. It's the same. I know exactly what this feels like. Yeah. Yes, I know.
Like, no, I've never been in there before. Like, no one's been in there before.
Clear that. Wow. I know, that's tough.
Yeah, that is.
Gotta get rid of all that.
It's almost like it's webbed.
Yes, yeah, I just.
That's bad too, huh?
Can't be any. No soreness, nothing. Ed, can't you push any harder?
I feel it.
Yeah.
No!
Not the rhomboids. The rib heads.
They've been causing problems. They've been causing problems.
So everything, good.
I was gonna ask if you ever get tired, like, because this has to be work for you.
Sure. I mean, it's just your body gets used to it. If anything, the muscles I must use when I'm working on you are probably in pretty good shape. That doesn't mean that I can do other things. Like I tried to lay a pallet of sod a couple of years ago, and my hamstrings were killing me. Apparently, I must not use those muscles very much. Anyway, I know. Yeah. I want to clean. This is what when you said your arm was. You're feeling what you're feeling. I'm gonna just clean this whole channel and then sort of.
Thank you.
See how your body responds to. There's definitely a lot of monsters in here, like right in here.
Yeah.
And that the nerves are having to travel through here. So I also think about when you landed and busted this arm, how much force went into your neck, right? So even though I know this is what broke, and I know, Ed, I didn't break my neck, I get it, but you definitely put a lot of stress on your lower neck. It might not have reached a measurable symptomatic level, but that's what I think about. I'm looking at this channel as the cause. This we call it the thoracic outlet. The nerves have to flow through this channel right here. So having acidity in here is at least 1/3 of the cause. Having your upper neck tight is a part of the cause. Having this rib up here raised is a part of the cause. And so we're trying to bring the ribs down, clean the channel, get the vertebrae in the neck in place. And it's not, it's something I deal with all the time. It's just addressing each piece of what we call thoracic outlet syndrome. The channels are pinched. Think of that movie 300 with the Spartans. Everybody's having to funnel through a small channel. So just, and it was just the left leg. Is that correct? Mm-hmm. Yeah, just the left leg was feeling that. Yeah, this is just the tightness in here creates that acidity.
From the foods that I eat?
Well, no, I'm sorry. Lactic acid is this like cellular exhaust. If I ask you to hold a bowling ball with your arms outstretched in front of you, your muscles will burn sugar and then not have oxygen to bind to lactic acid to form carbon dioxide and water. And so that lactic acid is the exhaust that muscles produce when they burn sugar. And so it makes it burn. It's an acid. And so the tissue fills up with acid, and then you touch it and you go, ow, it hurts. So the acidity is actually irritating the nerves. And then, like I said, the sensation down your leg is affected by the tissue in here, the disc. So when you don't feel any difference, so when you cough or sneeze or anything, nothing. So it's called a valsalva. When you cough or sneeze, it can. If it was a disc, usually that would be, something that makes it. It's probably more that the joint's inflamed in here. The joint and the disc on other side of the nerve. So the nerve's in between the joint and the disc. And so if the joint can be swollen and hit the nerve, or the disc can be bulging and hit the nerve, and the joint is sort of transient. It's just a knuckle. It's like if I punch a wall, my joints get swollen, right? And then after you ice them and they calm down, they go away. Does that make sense? The disc is a non-regenerable substance that it's like cartilage in your knee. It once it's damaged, it's like enamel on your teeth. It doesn't regenerate. So it's a higher value structure. All back surgery generally happens because the disc is damaged in some way. And so how do we...
Because of like loss of collagen as well and all of that as you age?
Well, it's more like an enamel on your teeth. It's something, it's a wear structure. It's like tread on a tire. There's only so much tread. These two guys age very quickly. No aging up here. Right? So it's not the age, if it was collagen loss when we age, then we'd see it up here because these vertebrae are the same age as this guy. So I can't say it's aging because I typically see almost little to no evidence of aging up here. So it's where you bend, it's where the vertebrae bend determines where the collagen or the cartilage ages. And you don't get to decide where your back bends. It's a volunteer structure. And so a lot of what I'm doing on this table is looking at the areas that aren't bending and trying to get them to bend as much as possible. I think of it like brushing teeth. Just if somebody hasn't brushed you in a while, there's going to be a level of plaque that's, to be expected. And so we're going to try to teach you in a little bit how to stretch, and that can help you, learn how to brush your own teeth in that sense. keeping your own spine clean with things you can do at home.
Yeah.
You know, you're not totally dependent on the dental hygienist to keep your teeth clean.
Right.
You kind of are supposed to learn how to take care of yourself. And
Right.
yeah. There we go. So piriformis, gluteus medius, the muscles in the glute area, these muscles can affect the sciatic nerve by their proximity to the sciatic nerve, and any soreness or contraction of these muscles builds up that acid we talked about,
Yeah.
and that leads to sensitization of the sciatic nerve, making it easy for the sciatic nerve to be,
Irritated.
irritated. Right, you got it. So we got to clean. You can't have any tenderness in here. That's sort of the.
And I do.
Right.
I feel it like right now as you're doing that.
Yeah, we want to work through that. And the mobility of the joint, the SI joint, which is what we checked when you were on your side and I rotated you, that joint being adjusted helps to relieve some of the stress on these muscles, which then cleans out some of the lactic acid. If the joint's moving properly, then the tissue is more apt to stay clean.
Yeah.
Sitting locks the SI joint, which then causes lower back and hip discomfort.
Yeah.
So keeping the SI joint moving, keeping this tissue in here clean. We're just going to keep going deeper and deeper on that. Wow, big difference.
Big difference.
Whoa.
Yes, sir.
Whoa. Talk about, I thought it was just strong muscles on his left glute. No, there's almost no contraction over here on his right. And there's a huge amount of development on, there's an abuse of that left side.
Yeah.
All right. And part of it can be, to me, sometimes it's because we're not utilizing our right. So because the right might be avoided, and so it's almost just as important to work on the opposite side as it is the symptomatic side, because the right side might have something that is making you avoid it. Does that make sense? And that's what's abusing the left.
So you kind of like to stimulate or trigger.
Right. I want you to try to use the right side more, and that'll take the stress off the left. So it's not just about trying to clean the left as much as it is why is this side so underutilized that the left is so developed. There's usually, and with the scoliosis, that's usually enough of an explanation that this laterality here makes this side get used more.
Yeah.
And so that it's just, we have to keep things clean. We have to keep things mobile.
Yeah.
And with the asymmetry of our spine, I feel it with my own back when I go too long without being adjusted. I start feeling that asymmetry. And right there. Okay, there. You're right there.
Yeah. Oh wow, that's going all the way down to my leg. What the?
Right there.
Tickles.
Right there. So, you know, this is the acidity that's in there.
Yeah.
You know, it's just, and then on your left lower, there's some more down here on that left lower.
Yeah.
Really big, but
That whole part looks bruised.
right. It's just this tightness in there. It's going to face down for me. I gotcha. Here we go. There it is. Nice. Good. Good. I gotcha. Let me breathe, Ed. There's this side here. There it is, a little piece. Yeah. You did good. Why? I know.
Has to be done.
Yep. You want to work that side. There we go.
That rolling thing isn't fun. I didn't expect that.
Right. Real gentle. Here we go. There you go. We actually want to tilt you to this side and push that. Breathe. There it is. Good. Breathe. You okay?
Yeah.
Here we go. Good. I know. Not anymore. Did good. So we're just trying to push that side in a little bit and try to, get that to be lined up. I gotcha. Go ahead and tilt your head to the left a little bit for me, real gentle.
I didn't expect that.
Oh my.
Ripping your ear off.
Oh, that's too much.
Right.
I got you. Tilt your head left a little bit for me. There we go. I got you. Tilt your head to the right a little bit for me. I got you to the right. Almost there. Okay, it's okay. We hover that. There we go. Tilt your head to the right. There we go. Okay. Hello.
Yeah.
I got you. Press back for me. There we go.
What'd that do? My elbows?
Shoulder. Just trying to
My shoulder.
pull that shoulder back.
But my shoulder cracked, right?
Yep,
I mean, my
yep.
elbow cracked, or was that my shoulder?
That was your shoulder.
Oh, wow.
I got you. Bring your elbow back here for me. There we go. Good. Trying to pull that.
Can we do that to my knees?
Let me have you lay on your back. Yeah, let's lay on your back.
Because it clicks like 4 times out of the day on its own now.
Let me check it here. I got you. Let me hold your leg. I got you. There we go. All right. Not too much. With the dancing, there's too much weight on the toes,
Oh, yeah.
and then the toes get jammed,
Ooh.
and so we got to keep. Yeah, we got to keep these. Yeah.
Oh, wow. I'm guilty of wearing too small shoes sometimes.
Actually moved. You're fine. Here we go. My sister would say dinosaur bones.
Ooh. Ooh.
Oh!
I feel like they needed that.
Let's check this knee. I got you. There we go. All right. Not so much. Check. Go on. Hold yourself above your head. Yeah, hold yourself there a little bit. There we go. Good.
Ooh, I felt that in my ankle.
Yeah.
Dude.
Yeah. Yeah, we got you. There you go. Good. Nice.
I felt that here. He hated that. Yeah.
All right. Get the idea. You're trying to stretch and press on that right upper,
Okay.
and you almost would roll right there.
Ooh, okay. Yeah.
And then you roll down a little bit. So up there you go, you get it, and then do the same thing.
In the middle portion?
Well, just that whole upper back. So you this would be the lowest part, and you roll back the way you came a little bit.
But only on my right side, not my left side.
So the right upper, and then the left lower. So on the other side, we'll do this. So we'll do the opposite on the lower.
Okay,
so roll back
let
the
me
way.
get this. I'm gonna do my back mid,
Right.
my right
Upper.
upper and mid.
Yes. And then then it'll be the left lower. There's actually a better device for the left lower that I'm gonna go get.
Oh wow.
And you see how she's laying on it?
Yeah.
Down and lower. So
Yeah.
in the lower, on the upper part, I find that on the right upper you can use the roller because then you can move around a little bit. But for the lumbar area, you have to have more pinpoint pressure because you have the iliac crests in the way. So to get that on that left side of your back,
Is that what your hip?
I'll show you. So for that left lower, you and I both need the same thing. So it works like this, and you'd be stretching, and almost like, and then you almost roll back on it a little bit.
Yeah.
So you go on the side, I almost stay like 45, trying to get pressure on that left curvature. So you're taking the device
Yeah.
on the high side of the curvature to press it in. So on the right, so it goes left in the lumbar and then it goes to the right in the upper back.
Yeah.
So you're on the right upper with the roller, and then the goal is 20 minutes. Now, like I said earlier, there is a baseline because your spinal column is too long and your spinal cord is not long enough.
Yeah.
And I found with my own spine that if I try to make it straighter than 19 degrees, I get headaches.
Okay.
So it's going to be something you're going to have to
Gauge.
right? Like, you'll be able to bring it down a little bit, but I don't know where that baseline is. It could be 5 degrees. Your baseline could be very minimal scoliosis. We don't know until you start stretching where that is. You definitely can feed it to be larger than 19 for me, but you're on the left lower here on the apex.
Yeah.
And you can use this in the thoracic on the right. That makes sense. You could use the same guy
Yeah.
to stretch. It's harder to move, obviously, but it's actually probably a better
Open
stretch.
that side out.
It's more pinpoint.
Yeah.
And then you're actually trying to grab this left arm
And stretch it.
and pull it up
Yeah.
to stretch the left upper that's also bound.
Yeah.
So you have to stretch the ligaments on the left upper and the right lower
Yeah.
to pull the spine in straight.
Yeah.
So I think about it, you're using this arm and you're trying to pull and you're trying to feel it all on this.
I can do that on the roller too, though, right?
Correct.
Ooh.
Yeah. Get some pressure on that lumbar. Yeah, there you go.
Yeah.
On that lumbar on the left,
And just chill.
and just chill for 20 minutes. That's how you're going to.
Yeah.
But the main thing this will help is with that swelling and joint inflammation. I doubt there's any disc injury because of that scoliosis and the weight sharing that provides. Your right upper and left lower need to be compressed. Makes it easy to tilt left.
Mm-hmm.
They call it half moon in yoga. Would be you go up,
And that.
and like I'm always trying to grab this and trying to stretch. Because laterality mainly does the chest, the lumbar vertebrae are made for rotation.
Mm-hmm.
They don't do as much lateral bending as the chest vertebrae are made for lateral bending. So when you're doing the lateral tilting, you're mainly trying to address that right thoracic curvature.
Oh.
So I know we have the left also, so you
Okay.
think, it's like, well, this is making the left worse, but you're mainly addressing the chest.
You're trying to do the chest area.
Right.
So don't try to
Well, you
put so
can't.
much force in here.
You can't. It's just, we're mainly trying to reduce this guy.
This part, yeah.
So you're trying to grab, push your arms above your head. I know, there you go. And then you're trying to pull up and then over to the right. Now the goal, and I know exactly, you're trying to tug and trying to, so you mainly
Get
feel
up
it.
in here.
Yeah.
Like up in here.
Correct, you got
Yeah.
it. You're trying to stretch that upper chest.
Okay.
And then if you went to the left, see, it's,
Yeah.
there's not as much difficulty.
Yeah. And not as much, honestly, like even me pulling, it's like I don't really feel it.
That's
here.
like already stretched
It's not
all the
like
time,
I really
right.
feel it. Like I feel it needs it here.
Yes, that's what we need to work on.
Yeah.
So, he wants me to get naked.
I want to get a picture of you guys.
Shows you the strip.
Right? This is what we have to work on. Ah. She's just getting thumbnail, I think. Oh.
Yeah, but if you want to stretch while I do it,
Somewhere in there, babe, right? You got
I
it?
think that's good.
That's what we have to work on. All right, brother.
Yes.